Hey everybody, it's Jake. I'm here to do my head and neck assessment video. I'm going to show you around my room to show you there's no notes anywhere. Miss Beatrice has volunteered to be my patient today, so I'll get out of your way. I don't have any notes anywhere in the room. I'm going to give you a quick 360. Now we're going to begin the exam as soon as I get this camera fixed up. Hello, my name is Jacob. I'll be your student nurse today. Can I see your patient badge ID? Could you tell me 2 identifiers about yourself?
My name is Beatrice Bozen. I was born May 24th, 1960.
Okay, I'm going to provide for privacy by closing the door. I washed my hands. I'm going to check your chart, and we're going to begin. So what brings you in today?
Well, I had a little lump on my head I was concerned about.
Okay, I saw your chart. You're here for your examination of head and neck too, as well?
Yes.
Okay, so what we're going to do is I'm going to begin with your skin and hair, and we're going to work our way down.
Okay.
So I'm going to feel your head and see how it is. I do feel that bump right here. It's about a pea size. It's partially solid, but it does move a little bit. Otherwise, the rest of your scalp, there's no discoloration, no buildup, no dandruff, no anything like that. The skin color is good. Your skull is symmetrical. There's no deviations. Everything feels relatively good. So we'll note that bump later and we'll discuss it. I'll write that down. Do you have any problems with your hair falling out or ingrowing or anything like that, or being dry?
No, I only lose a little bit when I'm taking a shower. There's a little bit.
Okay. When I did feel this, your hair feels full and good. It's sleek, silky. Nothing negative about it, so that's pretty good. Your scalp was good too. No problems with that. Do you have any problems with the skin on your face, like eczema, psoriasis, lesions, rashes, itching?
No.
No? Okay. Any other things about that I should be concerned about that you know of?
I don't think so.
No? Okay. So next thing I'm going to do is, from what I can tell, your eyebrows are good and symmetrical. The same with your nose and lips. Everything looks relatively good. No cracking, no anything like that. Next thing I'm going to do is I'm going to feel your jaw, okay? Open and close for me. Okay, thank you. The jaw is relatively good. I heard one crack. Everything aligns well. That's pretty normal. It's nothing very much to be worried about. So the next thing I'm going to do is I'm going to do something called a sharp and dull test, okay? When I do this, I need you to close your eyes, and I'm going to test your facial nerve and tell me if it feels sharp or dull and where I touch you.
Okay. That would be this cheekbone. I think it's dull.
That's right. Okay, moving on.
That would be down here. I think that was dull.
Okay, next one.
That would be up here. Might have been sharp.
Okay, next.
That's right here. That's definitely sharp.
Okay, last one.
That's right here. It felt dull.
Okay, you can open your eyes. That was a good test. Can you raise and lower your eyebrows? Okay, so that means cranial nerve number 5 is intact. All your facial muscles are working as needed. So I'm going to start with an eye exam now to see how you're doing with that. Do you have any problems with your vision or anything like that? Do you wear glasses normally, or?
No, only, with age, you have to wear reading glasses.
Okay. So I'm going to do a pupil test. I'm going to shine a light in your eye, and I'm going to see how your pupils react, okay? So first one from the front. Good reactive. Now I'm going to block it to see how your other one works. Good reaction. Now other side. Okay, same thing. Your pupils react and recoil accordingly. They also cooperate together. When one goes, it does the other one. So that means your nerves are working right. So cranial nerve number 2 is working good for you. Next thing I want you to do is, can you look at the clock on the wall up there? And when I move my pen in front of your face, can you look at it when you see it? Okay, good reaction. Now, examining your eyes, your pupils are good and round. There's no discoloration or anything like that. Your eye conjunctiva and your eyelids all look good and pink. There's no discoloration, no swelling, no nothing like that. Your eyes are symmetrical. And also, as I'm seeing this, the top of your ear lines up with the bottom of your eye. That's how it's supposed to be. So that's good. You said you have reading glasses. Could you tell me when you needed that first?
Oh, probably after 40, 45, 40, 45.
Okay. Next thing I'm going to do is just a simple awareness test. You told me your name already. Can you tell me where we are now?
We're in Dr. Maché's office,
Okay. Could you tell me what year it is?
2019.
Can you tell me who our president is?
Donald J. Trump.
Okay, good. So you're alert and oriented ×4. You have appropriate behavior. There's no acting out or emotion response. You're dressed good for the occasion. You're well groomed. So everything's good on there on neurological. So the next thing I'm going to do is I'm going to see how your nose is and if you have anything with that. Do you have any sinus problems or anything like that?
No, I've been lucky. Haven't had it.
Okay. Is it affected by any kind of allergies, or do you have allergies that give you any nasal problems?
Nope.
Okay. So none at all? Is your sense of smell pretty good?
Yeah.
Okay. So that's your cranial nerve number 1. That's for your nose, so that's pretty good. So I'm going to see how it looks. The nose is good. It's pink on both sides. There's no discoloration or anything like that. The nasal septum is intact. There's no deviations, no holes, no anything like that, no excess buildup of discharge. Sense of smell is good. Okay, so we're going to do a nose patency test. So for this, can you cover one nostril and just breathe through the one that's open and then switch? Outside. Okay, that's good. So if you would have had any problems with that, we would have had to follow up. Also, same with your eye test. If we had any problems with that, I would refer you to a Snellen chart so we could check and see how your vision is, but they probably did that when they fitted you for glasses. So you're pretty good with that. Next thing we're going to do is your ears. Do you have any problems with your hearing or anything like that? Any assistive devices or any problems?
No, it's still pretty good.
Okay. So I'm going to see how your ears look. It's good and pink on the inside. I'm not seeing any discoloration, any buildup of cerumen, any lesions, anything bad like that. Everything looks pretty normal. I'm going to pull this back and take a look further in. Eardrums are gray, no discoloration. Everything looks good. You said you don't have hearing issues. So next thing I'm going to do is I'm going to test for tenderness and pain. So I'm going to touch you in a couple places and tell me if it hurts at all, okay? Any pain in the tragus area?
No.
Okay. Is there any pain in the auricular area when I do this?
No.
Okay, now I'm going to push where your malleus is, kind of on the back of your head. Any pain?
No.
Okay, good. I'm going to move on to your sinuses since we're back to the front. Let me know if there's any pain when I put pressure on this, okay? Any pain?
No.
Okay, no pain in the frontal area? How about maxillary?
No.
No? Okay, so that's good. We're going to move on to the mouth. Do you have any problems with dry mouth or excessive tooth decay or anything like that?
No, just No.
Okay, like I saw before, your lips are good. No chap, no lesions, nothing like that. Can you say I for me?
Ah.
The mouth is nice and pink on the inside. Buccal mucosa is good. Can you stick your tongue out? Tongue is good. No discoloration, no lesions, no splitting, no nothing like that. Can you say ah one more time?
Ah.
Uvula is good and pink. Some cavities, but that's to be expected. Can you move your tongue side to side? Can you move up and down? Yeah, that tests for cranial nerves 9, 10, and
I
12
don't know about that.
are intact, so that's pretty good. But that was good. That's how you do it. Next thing I'm going to do is I'm going to press down on your shoulders, and can you press up against me? Okay, that's good. Now I'm going to press against your head. Can you push back against my hand? Okay, good. That means that cranial nerve number 11 is intact. We're going to go back to the eyes, because I forgot one thing. We're going to do the cardinal movements. So can you follow my pen with your eyes as it moves side to side, but don't turn your head. Good. There was no jerky motion. Eye movement was slow and fixated and focused. No problems with that. So that's good. I'm going to inspect your lymph nodes to see if there's any swelling or anything like that. If they're healthy, I shouldn't feel anything. Or it could be present if it's a little bigger, but it still is not a problem. The problem would be if it's very hard. That means it's inflamed or could be almost a cancerous in a way. So preauricular, I don't feel anything, so that's good. Postauricular, again, I don't feel anything. Occipital, no nodes. Submental, no nodes. Submandibular, no nodes, but I do feel a mass here on your neck that you told me about earlier. So we're going to look into that later, okay? So tonsillar, and you had your tonsils removed, right?
Yes.
Okay.
When I was 4.
Anything else?
Adenoids, I think.
Okay. I did notice some difference when I was looking through your mouth that the tonsils were probably like +1, and now that we know why, because they're not there. So moving down, cervical. I do feel them there, but they are as they should be. They can be moved and they're manipulated and squishy. Supraclavicular. I don't feel it down here. Okay, now for this one, can you look down into the side? Well, I feel over here. I'm going to feel for your posterior cervical and your deep cervical, okay? I don't feel anything there, so that's good. This is the awkward one. Deep cervical. Okay, now let's do the other side. Deep cervical is not feelable. Posterior. Nope. So lymph nodes are good. No major problems. We'll inspect this down here after we're done. Okay. Let's see. Everything's pretty good and check it out. Last thing we can do is the Romberg test. Can you stand up for me? What I need you to do is, can you close your eyes and then just try to stand still? Okay. You can sit back down. There's no swaying or anything like that. It was a pretty good balance. So that means no ear problems in the inner ear or anything like that. Cranial nerve number 8 is intact. Oh. I know it's kind of high. And so, is there anything else? I think we're done with our test today.
Well, thank you.
Yep. And we'll follow up on those things after I go and chart this down, okay?
Okay, thank you, sir.
Nice working with you today, Ms. Elizabeth.
Nice working with you.